So these are our batteries that we have. Each hearing aid is either going to be rechargeable, where you just plug it into the charger, or it's going to be battery operated. We have our size 10, our size 13, 312s, and 675s. They vary in size as well as thickness. Obviously, the more power the hearing aid will need, so a Power BT is going to use the bigger one, that's 675. These are some of our hearing aids. Here we have all of our custom ones, and then here we have those ricks that will sit behind the ear like that. We have our dome on them. Most hearing aids will either have a dome or a custom ear mold piece. So as you can see, these are going to sit completely in the ear, while this one's going to be that invisible in the canal. This one is the mic and helix. With this one, obviously, that just sits like that.
When you do a listening check, you would stick the listening scope with the receiver, test 1, 2, baseball, cowboy, hot dog, see if the output's where you want it, and then if you also give it a little squeeze, you'll hear a little squealing, and that's when you know it's working. Before you place anything into a patient's ear, you always want to take a look with the otoscope. With an adult, you would pull up and back. With children, you pull down and back. You always want to brace. Up, back, and look in. It looks good, and then you're all done. Okay, so we're going to be taking an ear mold impression for a hearing aid. These are the different colors that you can choose. First, you will choose an odo block. We have small, medium, and large. Then you will mix a catalyst and a base. This will harden as you put it in the ear. This is the syringe you'll be putting it through, and the pen light. Before you start, you should do a otoscopy. Always look in the patient's ear first. And then you put the odo block in. Grab your pen light. Pull up and back. Make sure it's past the second bend. All right, and then you mix these, the catalyst and the base. This will harden. It usually takes 5 minutes. Cut off the first part, make sure there's no air bubbles. You lift up and back, syringe in. And you want to make sure you get every part of the ear.